Hello everyone, welcome back to my YouTube channel. Hope everyone is doing fine. Don't forget to subscribe, to like, to share and to comment. So today we are going to look at the management for infectious conditions. So there are two types of management. There is medical management and nursing management. Under medical management, this is where you write about the investigations and the treatment. So our main focus today is on the nursing management for infectious conditions. So in writing a nursing management during exams, it is of the utmost to follow the outline. So our outline is going to start with the aims. Under the aims, we are going to say to promote quick recovery, to prevent the spread of infection, to promote rest, to allay anxiety, and also to promote nutritional status. From there, we are going to move on to the next heading, which is patient isolation. Under patient isolation, we are going to say, I will nurse the patient in an isolated ward to prevent the spread of infections. Number 2, we are going to say, I will nurse the patient in a clean environment and well ventilated so as to promote air circulation. Number 3, we are going to say, I will ensure that in the room there is the suction machine, the BP machine, the thermometer, and also the emergency tray for easy access. From there, we move on to the next heading, which is the infection prevention. Under infection prevention, we are going to say, I will put on protective garments when handling the patient so as to prevent the spread of infection. Number 2, we are going to say, I will wash hands before and after every procedure to prevent the spread of infection. Number 3, you are going to say, I will use only sterile equipment on the patient so as to prevent the spread of infection. Number 4, you are going to say, I will advise the visitors to put on protective garments so as to prevent the spread of infection. Then the last point under infection prevention, we are going to say, I will do damp dusting to prevent the spread of infection. So the next heading is going to be disease notification. Under disease notification, this is where you say, I will notify all members of staffs about the infection so as to make them alert when handling the patients. Number 2, you are going to say, I will make sure that the Ministry of Health is informed about the outbreak of the same infections so as to know the right interventions to put in place. Number 3, you are going to say, I will label the specimen so as to make the members of staff alert that it is infectious. So the next heading that we are going to look at is observations. Under observations, we are going to say, I will check vital signs to act as my baseline data. Number 2, I will check if there is rising in temperature and remove excess clothing so as to normalize the temperature. Number 3, you are going to say, I will check for the rising and the falling of the chest to rule out any difficulties in breathing. Number 4, you are going to say, I will assess the cannula if it is in situ, and if it is not in situ, I will recannulate for easy administration of drugs and also fluids. So the next heading that we are going to look at is psychological care. Under psychological care, we are going to say, I will explain the disease process to the patient so as to promote knowledge and allay anxiety. Number 2, you are going to say, I will tell the client to be asking questions and answer them accordingly, and those I cannot answer, refer them to other physicians. Number 3, you are going to say, I will involve the family members in the care of the patient so as to promote the sense of belonging. The next heading that we are going to look at is hygiene. And hygiene, we are going to say, I will wash hands to promote hygiene. Number 2, we are going to say, I will do assisted bath to promote self-esteem and also comfort. Number 3, you are going to say, I will do hair care to promote self-esteem. Number 4, you are going to say, I will do oral care to prevent acidosis and also to promote appetite. Number 5, you are going to say, I will do nail care so as to prevent odor infections. So we move on to the next heading, which is exercises. Under exercises, we are going to say, I will do partial limb exercises so as to promote the circulation of blood. Number 2, we are going to say, I will encourage or advise the patient to be doing breathing exercises so as to prevent any difficulties in breathing. So we move on to the next point, which is nutrition. Under nutrition, we are going to say, I will give small but frequent meals so as to promote appetite. Number 2, you are going to say, I will give foods, I will give a well-balanced diet food to the patient so as to promote healing. Number 3, you are going to say, I will advise the family members to be bringing attractive foods so as to promote appetite. So the next heading that we are going to look at is elimination. Under elimination, we are going to say, I will observe for the input and the output to prevent constipation. I will also observe for the input and the output using a fluid balance chart to prevent fluid overload. The next point that we are going to look at is advice on discharge. Under advice on discharge, we are going to say, I will educate the patient on the importance of taking medication so as to promote quick recovery. Number 2, we are going to say, I will educate the patient and the family members about the importance of having a balanced diet meal so as to promote the nutritional status. Number 3, you are going to say, I will educate the patient on the importance of review dates and tell them to come before the review date if there is an emergency so as to promote quick recovery. Thank you so much for watching. Don't forget to subscribe, to like, to share, and also to comment. Thank you so much. See you some other time.